19 maski yakoyo ikhoza kuteteza ena kuti asatenge kwa iwe.
Mukatero mukhala mukuteteza tonsefe.
Ndipo ngati ulibe COVID-19 maski yakoyo imakuthandiza kuti upewe utenga kachilomboko. Ndathokoza Jen. Ndikhulupirira kuti kuyambira lero uzivala maski yakoyo monga mmene umangondera kuchena zovala zakozo mwana wanga.
Welcome to the news on Zodiac with me, Simon Gilesiambo. The headlines. Public health professor urges Malawi to exercise caution on its decision to use the Oxford AstraZeneca vaccine. AU supports COVAX initiative which ensures equitable distribution of COVID-19 vaccines on the continent. Angry citizens in the Idza district stormed the DC's office in angry protest after going 3 weeks without electricity. And in sports, DD Sunshine Club banking hopes and support from farm and war wishers to participate in the COSAF Women's Champions League. Now the news in detail. A public health expert, Professor Maureen Chirwa, has urged Malawi to exercise caution on its decision to use the Oxford AstraZeneca vaccine after South Africa put on hold rollout of the vaccine. Professor Chirwa says she was surprised Malawi has opted for a vaccine which is still being developed. South Africa has pulled out rolling out of the AstraZeneca vaccine on hold, and a study showed it did not do well against the new COVID variant in the country. This report by Western Gura.
Public and environmental health expert Professor Maureen Chirwa and health rights activist Joy Jobe are of the view that government should seek scientific guidance on whether the AstraZeneca Oxford vaccine that the country has procured is effective or not. They have reacted to news that South African government has suspended the vaccine following proof that it is less effective to the country's variant of COVID-19. Professor Chirwa observes that government's action on the AstraZeneca Oxford vaccine is out of panic and that President Lazarus Chakwera is only trying to save the situation. Professor Chirwa has made reference to cheap HIV/AIDS drugs whose consequences were deformities on some patients, hence the call to act wisely.
Maybe half-loaf is better than none. Let it come, let's go ahead, procure, but also be ready that as they develop more, those other second doses, they should be coming so that they cover up on how things are changing as we go along.
Health rights activist Joy Jobe has asked government to involve the Pharmacy and Medicines Regulatory Authority to scientifically prove the effectiveness of the vaccine.
The legal technical expert body should make a voice. Pharmacy and Medicines Regulatory Authority, they should come in, should do its tests, should make a statement. This is a pharmaceutical issue.
The AstraZeneca Oxford vaccine has proved ineffective to the South African variant, which has also hit the country, forcing the Rainbow Nation to suspend distribution. Reporting for Zodiac in Lilongwe, this is Western Guta.
Meanwhile, co-chairperson of the Presidential Task Force on COVID-19, Dr. John Puka, says the committee has taken keen interest on the developments in South Africa and will be making a position. But Sunday night, President Lazarus Chakwera defended the vaccine, which he said was affordable and has 60 to 70% efficacy. This is part of what he said.
So the type of vaccine we will receive here requires the same number of shots as many of the other types. A second area of interest is the efficacy of the vaccine. Different vaccine types vary in their efficacy, but all of them have an efficacy level above 50%. The vaccine type coming to Malawi has an average of 60 to 70% efficacy. Although this is a lower efficacy than that of 5 of the other vaccine types, it is high enough to save millions of lives.
The African Union has supported COVAX initiative, which will ensure equitable distribution of COVID-19 vaccines across the African continent. The African leaders expressed their support during the 34th ordinary session of the African Union, where acknowledgement was made for the formation of what is called the African Vaccine Acquisition Task Team to assist African countries to access the COVID-19 vaccine. And during the conference, the AU has elected President Felix Tshisekedi of the Democratic Republic of Congo. Western Guta with more.
Minister of Foreign Affairs Eisenhower Nkaka started by saying the 34th ordinary session of the African Union appreciated the restructuring of new partnerships for Africa and NEPAD into the African Union Development Agency, AUDA. Nkaka added that from NEPAD, Malawi has benefited a lot, including a rapid response to COVID-19 pandemic, equitable access to COVID-19 vaccine, the agriculture sector, and trade in the free trade area. On the vaccine, Nkaka said that the African Union is supporting the COVAX initiative, which will ensure equitable access to the COVID-19 vaccine across the continent. The Foreign Affairs Minister added that the African Union health experts will review and advise on the way forward of distribution of AstraZeneca vaccine, making reference to the suspension of the vaccine in South Africa on account of less effectiveness to the South African variant.
There is need for Africa to work closely with the institutions that are responsible for the development of the vaccine. I must say that I think the expert will be working with the heads of state and government in order to come up with a vaccine that responds effectively and as far as the strain that has been found in South Africa is concerned.
The COVID-19 vaccine has become a topic of discussion recently, with concerns of depopulation across the globe and now ineffectiveness to the South African variant. For Zodiak in Lilongwe, this is Western Guta.
Deputy Minister of Labour Vera Kamtukule has called on employers in the country to ensure strict adherence to COVID-19 preventive measures at workplace in order to curb the spread of the pandemic. Kamtukule says while some companies are complying, there seems to be a gap in information among the employees, especially on procurement on the proper use of face masks. Noam Kubi reports.
Deputy Minister of Labour Vera Kamtukule says employees spend much of their time at workplace than in their homes. She said employers have an obligation to ensuring that their employees have personal protective equipment and are adhering to COVID-19 preventive measures to protect themselves at workplaces. The Deputy Minister was speaking on Friday after visiting Shauna Cement Corporation factory in Kasungu, where among others she observed that there were few places of hand-washing facilities and some workers were not putting on masks properly.
I'm happy to report that probably the basics are being complied with for now, but we still observe the number of issues that need to be corrected. For example, the awareness messages, maybe even enforcing on the wearing of masks, for example. But issues of social distancing were being observed. The other thing that we observed was that we didn't see a lot of hand-washing facilities or even people having hand sanitizers, for example.
Shauna Cement Corporation Human Resource and Administration Manager Austin Bula said the company was committed to addressing the gaps to ensuring that all employees are safe.
We appreciate that as Shauna Cement Corporation. We feel we are doing our best. And their visit also reflects the recognition of Shauna Cement Corporation, and the advice given is just to supplement or to complement whatever we are already doing on the ground. So we really appreciate the advice, whatever they've told us to do.
Apart from Shauna Cement Corporation, the Deputy Minister also paid a surprise visit to Lisandwa Estate, being managed by Pixas Agriculture. For Zodiac, this is Noam Kubi, Kasungu.
Now, 92-year-old Reverend Thompson John Chipeta of Mchinji District has survived COVID-19. His grandson, Shingai Chipeta, confirmed the development, saying the senior Chipeta tested positive for COVID-19 mid-January and was in isolation before being admitted to Mchinji District Hospital last week. This report read by Wilson Henry.
Principal and founder of Home of Hope Orphanage in Mchinji, Reverend Thompson John Chipeta, tested positive for COVID-19 mid-January. His grandson, Shangai Chipeta, says the senior Chipeta was in isolation for 10 days before being taken to Mchinji District Hospital last week. He says Chipeta is diabetic and has now been discharged after testing negative. Mchinji District has registered 11 cases of COVID-19, of which 345 out of 471 people have recovered. Reverend Chipeta owns Home of Hope Orphanage. The orphanage center was established in 1998 and currently keeps over 700 children.
Soto Sopra Malawi has supported Cholo District Hospital with 5 oxygen cylinders days after Zodiak reported about the challenges choking the facility in the fight against COVID-19. Team leader for the organization, Wheat Matabwa, says the support is responding to the SOS that the hospital sent while valuing the support the organization gets from communities in the district. Director of Health and Social Services for the district, Dr. Ano Chumbe, says the support is a lifesaver. He, however, expressed concern over misconceptions that people have over COVID-19, saying it is risking more lives than the pandemic itself.
We're facing a lot of problems. So far, COVID, yes, is a problem, but the general problem is the false news everywhere. Our patients are failing to come to the hospital to receive care in good time because of the false news that is all over social media. So sometimes patients come in very critical conditions, and you are unable to take care properly of these very critical. So we are giving the message to the general community, the general Malawi, that please, if you are sick, come to hospital in good time before it reaches the critical conditions. So false news is killing more people than COVID itself. So we need to unite as Malawi, we need to unite as people, that we should stop spreading false news, because it is hindering people to come to hospital in good time.
You're watching news on Zodiac. More news after the break.
Kodi ndinu nomwe somuzitichwa olemekezeka kwadi?
Koma mwachedo atu. Nakatobwera nazo drama zanozi. Mona mchedo?
Kungoti ndadzera ku Audibody. Ni makasiya mafomu ofotokoza za chuma, ma business, komanso za ngongole zimene ndili nazo. Ansathu munakaulula kale ngati?
Ayi. Komanso ndinezoulula zimangoona ngati nkungotcherana misampha chabe.
Kutcherana misampha kotani?
Olemekezeka.
Inu chuma choti mwachipeza mwachilungamo, ungachite mantha? Kapena tumwina mufuna mutapeza chuma chanu kudzera munjira zosalongosoka koma pogwiritsa ntchito dindo wanu.
Eso sichoncho.
Mwinatu. Chifukwa ineyo ngati MP, inunso ngati munthu amene muli ndi udindo kuboma, tinayenera kuulula chuma chathu, ma business yathu ku Audibody. Tisachite kudikira kuti mpaka nati kumbutse yayi. Komanso anthu amene ine ndimatumikira anayenera kukhala ndi chikhulupiriro mwa ineyo.
Zoona ndi.
Yetu. Mpaka na maina athu mpaka nati chiti discipline.
Sizabwino.
Ndibanga zomwezo komanso ndizawuza koso anzanga yena.
Akuluakulu ogwira ntchito zaboma, kandi ife amaudindo ochita kusankhidwa ndi anthu, kapena ndife ochita kulembedwa, tikuyenera kuulula chuma, ngongole komanso mabizinesi omwe tili nawo ku Audibody kuti tipewe kuyimbidwa mlandu, kuyimitsidwa kapena kuchosedwa ntchito kumene. Uthengawo ukukufikani kuchokera ku Office of the Director of Public Officers Declarations, Audibody.
If there's one thing that all soaps do, it's wash. From buckets to basins, bathrooms to streams, and everything in between.
All soaps wash.
Yes, but Protex is different. Its reinvented formula with flaxseed oil boosts your skin's natural anti-germ defenses by 10 times more, protecting you against 99.9% of germs. So what keeps us healthy?
Protex!
Good health starts here.
Kupeza zinthu zabwino sikulira kukhala ndi chuma koma kuzindikira chinsinsi. Pamene Yohane anatangwanika kufuna kumukomedwetsa tango, Yakobe anapeza chinsinsi cha tango kudzera pa lisiti la katundu amene anagula tango. Tango amagwiritsa ntchito zonse zopangidwa ndi Purity Sanitary Products, monga Purity wosambira mthupi, Purity wosambira m'manja, Purity wodzola mthupi, komanso purity wotsukira mbale ndi mapoto. Patangotha sabata imodzi Yakobe akugwiritsa ntchito zopangidwa ndi Purity Sanitary Products, Yakobe adatenga mtima wa Tango chifukwa chooneka bwino. Wonekani bwino pogwiritsa ntchito Purity Sanitary Products.
Welcome back. Let's take a look at the headlines. A public health professor urges Malawi to exercise caution on its decision to use the Oxford AstraZeneca vaccine. AU supports COVAX initiative which ensures equitable distribution of COVID-19 vaccines on the continent. Angry citizens in Dedza district stormed the DC's office in angry protest after going 3 weeks without electricity. In sports, DD Sunshine Club banking hopes on support from farm and war wishers to participate in the COSAFA Women's Champions League. On Monday morning, angry citizens from an area at the district headquarters stormed the DC's office in angry protest after going 3 weeks without electricity. We hear the blackout is as a result of a 40 ESCOM transformer in the area. Spokesperson for the District Council says ESCOM has been promising it is working to replace the 40 transformer. Chikonde Mpande sent us this report. According to the angry Dedza residents, the electricity problem has negatively affected their lives for the past 3 weeks. They lamented the thieves are taking advantage of the blackout situation to continue breaking into people's houses in the area. In addition, they claim the children are now flocking to video showrooms as they have nothing to entertain them in their homes during this COVID-19 school holiday. They told us although they presented their concerns to the ESCOM office, they are not getting tangible response. Receiving the petition, the District Council spokesperson Yohane Bilesi assured the demonstrators that their concerns will be addressed. According to Bilesi, ESCOM will purchase 5 new transformers this week, and one of them will be installed at Airfield. Some cotton farmers in Salima district have called on government to be in the forefront in finding better markets for their produce, warning production of the crop will continue dwindling due to low costs in the absence of the intervention. One of the farmers, Moses Itsamba, told us that only a few farmers have grown cotton this year due to poor prices and lack of stable markets in the last farming season. However, spokesperson for the Ministry of Agriculture, Gresham Lungu, says government is already working towards boosting the country's cotton industry. This report by Joseph Mazizi.
Some cotton farmers had their crops in their homes up until 3rd week of December last year due to lack of proper markets. This has led to most farmers shun the crop this year and have opted for maize. One of the farmers in Salima, Moses Tsamba, has told us government should move with speed, finding means of stimulating the production of the crop, which has the potential of making a significant contribution to the economy, with tobacco facing numerous challenges.
Variety that we are cultivating nowadays is an expensive one. Government needs to come in with subsidies it is doing with maize. And they also have to improve on the price because it seems the government is not serious on the cotton industry. And it's very unfortunate that this is happening at a time when tobacco is facing a campaign. And it was wise if the government had to invest in cotton as an alternative. So it's just a request to the government. They have to come with subsidy and they have to improve on the price.
However, spokesperson in the Ministry of Agriculture, Gresham Lungu, admits the environment has not been favorable to cotton farmers, attributing it to, among other issues, COVID-19, which has affected the international market. Malawi has over the years been producing low volumes of cotton, up to about 20,000 metric tons, far below the demand by Ginanas. Reporting for Zodiac from Salima, I am Joseph Mazizi.
In sports news, DD Sunshine Women Football Club says it is banking hopes and support from farm and war wishers to participate in the COSAFA Women's Champions League. The reigning Presidential Cup holders will take part in the maiden showpiece, which will be used as a preliminary qualification for the CAF Women Champions League. Club owner and founder David Due says travel and accommodation expenses are likely the challenges. That also brings us to the end of this newscast, and before we go, let's take a look at the headlines. A public health professor urges Malawi to exercise caution on its decision to use the Oxford AstraZeneca vaccine. AU supports COVAX initiative, which ensures equitable distribution of COVID-19 vaccines on the continent. Angry citizens in Delta District stormed the DC's office in Angry Produce after going 3 weeks without electricity. In sports, DD Sunshine Club banking hopes on support from FAM and well wishes to participate in the COSAFA Women's Champions League. Visit our website zodiacmalawi.com for more on these and other stories. My name is Sibongile Ziambo. Many thanks for watching, and remember that washing hands frequently with soap helps contain the spread of the coronavirus. Bye for now.